Well, when it comes to pain, it can take over and affect every aspect of your life, from the time you wake up to the time you go to sleep. But there could be some hope, especially if it's pain associated with rheumatoid arthritis. Joining us today with more is Dr. Ashraf Hanna, Director of Pain Management at the Florida Spine Institute in Clearwater, along with patient Teresa Gillispie. Thanks for joining us both today.
Thank you. Thank you.
Let's start a little bit about your experience with rheumatoid arthritis. How much did this affect your life on a day-to-day basis?
Yes, it started about 10 years ago when I noticed aches and severe joint pain. It wouldn't go away, so I consulted my doctor. We did a blood test. It showed that I had rheumatoid arthritis. Then my doctor told me that there's no cure for rheumatoid.
Right.
And then she also told me that my joints will slowly disintegrate.
That is a great prognosis there. And you're probably thinking the worst, like this is just going to get more painful all the time.
Correct. And we've tried oral medications, IV medications, and at first they worked, but eventually they stopped working. That's when I met Dr. Hanna, and he suggested we do the IV Ketamine infusion, and the effects were immediate. The pain was reduced, the swelling and the stiffness reduced. I noticed I had more energy. I could actually do something around the house. I even started cooking for the holidays. I felt like
your life very
yeah,
much.
oh yeah,
Very
I felt
much
like a new
so,
person.
very much
Yes.
so. Well, let's talk a little bit, Dr. Hanna, about the use of IV ketamine for rheumatoid arthritis. How did this come into play? How did you discover that this could be helpful?
Sure. Well, rheumatoid arthritis first is the most common form of autoimmune arthritis. And usually patients complain of diffuse, severe joint pain, stiffness, swelling, as well as severe deformity, and can become severely disabled as well.
And so how did you discover that IV ketamine is something that can work with this?
First, I want to make sure that ketamine, I will tell the patient that ketamine is not the first line of treatment here. Patients should be treated by their rheumatologist with oral anti-inflammatory medications, oral as well as IV immunotherapy. And that ketamine should be only reserved for those patients who failed that conventional therapy or develop significant side effects. And I got the idea for ketamine for rheumatoid arthritis when I got excellent results using the IV ketamine for severe pain that was associated with other autoimmune diseases like multiple sclerosis, lichen sclerosis. So this one I decided to treat Teresa, and we got an amazing response. Her pain went significantly down. And really the major thing here is a major breakthrough, because patients like Teresa did not have any other options besides high-dose pain medications.
This was it. This was a lifetime of being on pain medications, which obviously is not the way to go either. And you mentioned that and we've talked to you before about different things that you use IV ketamine for. I know fibromyalgia, you mentioned multiple sclerosis as well.
Yes, we use complex regional pain syndrome, fibromyalgia, Lyme disease, various neuropathic pain syndromes, and lately we've been using ketamine with great success for treatment-resistant depression as well as post-traumatic stress disorder.
Wow, there's a lot of different uses. Well, thank you guys so much. Congratulations again on a life that feels much better these days, I'm sure. Now, if you guys would like more information, all you have to do is head online to ivketamine.com, or you can call the number that is right there on your screen, 727-538-2646. That is all the information that you need for all of that as well.